Okay, we start off with something very important, and that is the cardiac arrhythmias. So first of all, the definition of cardiac arrhythmias. Cardiac arrhythmias are basically the abnormal rhythms of the heart. I said abnormal rhythms. So first of all, we should have a clear concept about what are the normal rhythms of the heart. Then we would be clearly able to differentiate between the normal and the abnormal rhythm, and hence I will be able to understand about this concept, that is arrhythmias. So I would like to illustrate this with the help of a diagram. As you can see, this is basically a graphical representation in which I am going to show the normal rhythms of the heart. This is 60, and here we have 100 beats per minute. This is 60 beats per minute, this is 100 beats per minute. The normal rhythm, you know, it is between 60 to 100 beats per minute. So I am defining the normal rhythms. There are 4 criteria for defining the normal rhythms, and all of them must be satisfied for the normal rhythm. First criteria is normal rhythm should be between 60 to 100 beats per minute. Normal rhythm should be between 60 to 100 beats per minute. This is the first criteria. The second criteria is the origin. The rhythm should be originating from the SA node. So the impulse should be coming from the SA node. Third criteria is that the impulse should be conducted through normal conduction pathway. It should be conducted through normal conduction pathway. And the fourth one, cardiac impulse should move with normal velocity. So all of these 4 criteria should be fulfilled for defining this normal rhythm. Okay, let me explain this with the help of a diagram. So first of all, I'm going to draw the heart, structure of heart. This is the fibrous pad between the atria and the ventricles, and this is your atria. This is your atrium. Then we have the ventricles. This is the ventricle. So I was talking of the normal criteria or the normal rhythm of the heart. So let me explain this. The first criteria was normal rhythm should be between 60 to 100 beats per minute. Second criteria was the origin should be from SA node. Here is your SA node. Here we have the AV node. Then we have bundle of His and Purkinje fibers that supply the ventricular fibers, ventricles of the myocardium. So the origin should be from SA node, that is the impulse should come from SA node. Third criteria is impulse conduct through normal conduction pathway. So what is normal conduction pathway? Normal conduction is pathway that the impulse generates from SA node, then the impulse is conducted through atrial fibers, then it reaches to the this AV node, atrial fibers to the AV node, then through AV node it is conducted through the bundle of His and Purkinje fibers, and finally the impulse reaches to the ventricles. This is the normal conduction pathway. And fourth is cardiac impulse should travel with the normal velocity, that is it should travel from SA node to AV node with a high velocity, then it should become slow in the AV node, and then finally it with a very high velocity it reaches to the ventricles. So this is the normal conduction pathway. So this is about the normal rhythm. All these criteria should be fulfilled for normal rhythm. For example, if we have the origin is from SA node, the impulse is conducted through normal conduction pathway, and cardiac impulse is also moving through normal velocity, but we don't have the rhythm between 60 to 100 beats per minute. Suppose it is 120 beats per minute, then it can't be called as a normal rhythm. Then it would be called as a arrhythmia. So this diagram can be illustrated with the help of a star. We have a star. Okay, the first point is normal rhythm, that is 60 to 100 beats per minute. Then we have SA nodal origin of the impulse. Then we have normal conduction pathway, and third one is the cardiac impulse should travel through normal velocity, through normal velocity. Okay, so this is the tail of this star, and you just need to get hold of all these points for the normal conduction, for the normal rhythm of the heart. If heart is deviated from any of these criteria, then we say it is arrhythmia. For example, if the impulse is greater than 100 beats per minute, then it is arrhythmia. If it is below 60 beats per minute, then it is arrhythmia. If the impulse is not originating from SA node, then again it is arrhythmia. If the impulse is conducted not through the normal conduction pathway, then again it is arrhythmia. And if it is not moving with the normal velocity, then again it is arrhythmia. So this was the basic concept about the arrhythmias.